Hey, Alenka,
Hey, Ethan.
have you been having any sex recently?
No. Well, have you?
No, I haven't. Just haven't found anyone. Same for you?
No, I'm just abstinent.
Oh, cool. What does that mean?
It means I'm refraining from any sexual activity, including oral, vaginal, and anal sex.
Oh, cool. But why'd you choose abstinence?
Well, many reasons. First of all, abstinence is the only 100% effective birth control. Many others are very effective, but not 100%.
Wow, never thought about it that way.
Exactly. It's also a great way to save money. I haven't had to buy any birth control pills or condoms.
Now you have even more money for other stuff you want.
Exactly. And I don't need sex to strengthen my bond with my partner. We find other ways to strengthen our relationship.
Abstinence sounds really cool. Too bad I can't be abstinent. I've already had sex before.
That's not true. You can be abstinent whether or not you're a virgin.
Awesome. It's settled then. I'm gonna choose abstinence too.
Record. All right. Condoms by and Jack.
What are condoms?
Condoms are a type of barrier method. They block the sperm from ever entering the vagina.
They can also protect from STDs.
It is also 99% effective for preventing pregnancies.
And there are male and female condoms.
And here's one picture of a male condom, and here's a picture of a female condom. When do I use a condom?
You should use a condom when engaging in sexual intercourse.
As it is a barrier method, it needs to put on, for the male condom, it needs to be put onto the male's penis, or for the woman, it needs to be inserted into the vagina.
This will protect both the male and the female from STDs.
For the female, the condom will stop the sperm from entering into the uterus area where there can be a fertile egg while sexual intercourse.
Preventing pregnancy.
And lastly, how do I put on a condom?
First, you need to open the condom packaging as it is very fragile, so be gentle when opening.
Next, you need to put the condom onto the erected penis, which is the top of the penis.
Then make sure you pinch out the air of the tip of the condom.
Then you can roll the condom down the erected penis.
After having sex, before you pull out of the vagina, you must hold on to the base of the condom and slowly pull out.
And lastly, remove the condom away from your partner and dispose of the condom. All right, I think.
Hey, what's that?
This? It's the birth control pill.
Try the birth control pill today, a daily pill that contains hormones to prevent pregnancy.
With up to 99% effectiveness, the pill releases estrogen or progesterone to thicken cervical mucus and prevent the ovaries from releasing eggs.
Don't want a baby? The pill.
Bad cramps? The pill.
Stubborn acne? The pill.
Say goodbye to unwanted pregnancies. And hello to protection.
With a prescription from your doctor or a visit to the health clinic, it's that easy.
Thanks, birth control pill.
May cause unpleasant side effects. Only 99% effective with perfect use. Does not protect against STDs, STIs.
Hey, I want to start using birth control, but I don't want to take the pill. Are there any other methods I could use?
You should try the ring.
The ring? What's that?
Its full name is NuvaRing. It's a safe, easy, and convenient form of hormonal birth control. It works by stopping the sperm from joining with the egg by releasing low, continuous amounts of hormones into your system.
Wow, that's really interesting. But how do I use the ring?
The ring is placed inside your vagina once every 3 to 6 weeks, depending on your schedule. Simply squeeze the side of the ring with clean fingers and insert it into the vagina. Don't worry too much about placement. Best part is, once it's in, you can't feel it.
Sounds easy enough to me, but how effective is it?
If all goes well, the ring can be up to 99% effective, but 91% effective with human error.
Where can I get the NuvaRing?
It's easy to get, but you need a prescription from the doctor's office or a health clinic. They can range in cost from $0 to $200 depending on your healthcare insurance, but most companies cover it.
So, what are some of the pros about using the ring?
It is very safe, easy to use, convenient, and low maintenance. It can even reduce acne, make your period lighter and more regular, and ease menstrual cramps. It has also been proven that patients who use the ring are less likely to have cancerous cysts or lumps, as well as cancer in the ovaries or lining in the uterus. But
What? Come on, tell me. What are the cons?
on the other hand, when the time does come to change the ring, it's really important you do so. Otherwise, you might not be protected against pregnancy. There are some side effects when using the ring, such as sore breasts, nausea, headaches, and bleeding in between periods, but they tend to go away after 2 to 3 months of using the ring. Also, the ring does not protect against the transmission of STIs and HIV.
Okay, well, thanks for all the information. I really appreciate it. One last question. Should my partner still be using condoms, even if I'm using the ring?
Great question. The answer is yes. Definitely still use a condom because they can prevent against STI and HIV transmission. Using a condom also shows that you care about yourself and your partner.
Good to know. Well, I definitely learned a lot from you. I think I'm going to talk it over with my parents and my doctor and see what they have to say, and then make a decision for myself.
That sounds like a good idea.
Thanks so much for all the help.
I'm Lexi.
And I'm Molly.
And we're here to talk to you guys about the shot.
The shot is an injectable form of birth control method for those with biologically female bodies.
Hormones prevent the ovaries from releasing eggs and thickens the cervical mucus to stop the sperm from reaching the egg.
The shot is injected into the arm, the thigh, or the buttocks every 3 months.
You can get the shot at a doctor's office or clinic.
The price of the shot varies depending on your insurance, but most insurance plans cover it.
The shot is 99% effective.
But wait, the shot doesn't protect against STDs or STIs.
That's why you should use a condom along with the shot.
Some pros of the shot are it's very effective. People who take the shot tend to have fewer or no periods. The shot can lower your chances of cancer in your uterus. And the shot can be taken by people who cannot take estrogen.
However, there are some cons to the shot. The shot can increase risk for bone fracture and osteoporosis. Also, it's recommended that you don't take the shot for more than 2 years. There are also some other side effects along with the shot that include irregular bleeding, headaches, and weight gain.
Overall, the shot is a great form of birth control.
Thanks for watching.
Hi, Madison.
And I'm Breno.
And today we're going over the intrauterine device, also known as the IUD. So what is it? An intrauterine device, or IUD, is a little T-shaped piece of plastic inserted into the uterus to provide birth control. And it prevents against pregnancy for 3 to 6 years.
How does it work? Well, there's 2 types, hormonal IUDs, which contain hormones like progesterone and copper, and there's also copper IUDs. Copper IUDs prevent pregnancy by thickening cervical mucus to block sperm from reaching the egg and affecting the ability of the sperm to move towards the egg.
So how to use it? To put an IUD in, the nurse or doctor will put a speculum into your vagina and use a special inserter to put the IUD in through the opening of your cervix and into your uterus. The process usually takes less than 5 minutes.
Where to get it? It can be obtained at a doctor's office or a clinic, but it must be inserted by a clinician.
So how much does it cost? The cost varies greatly, depending on your insurance, but it could be free. And the best way to find out is talk to a healthcare provider.
Effectiveness. It's 99% effective, and there's even less room for error because it's inserted by a medical professional. However, unfortunately, it's not effective in preventing any sorts of STDs.
So now we're going to go over some pros and cons. The pros are it's very effective, lasts long, You don't have to worry about it every day or month like birth control pills.
But the cons are it doesn't protect against STDs, and you need to go to a doctor's office to have it inserted, which can be a bit of a hassle.
Yep. Thank you.
Thank you.
I'm going to stop it.
The patch, also known as Ortho Evra.
Right. So what is the patch and how does it work? So it's for biological females or intersex individuals with biological female reproductive organs. It's a transdermal contraceptive patch, meaning it goes on the skin. So it's a thin, beige, flexible 2-inch square, and it's similar to birth control as it releases estrogen and proestrogen into the body. These hormones are used to keep the ovaries from releasing eggs, as well as thickening the cervical mucus to block the sperm from entering the uterus. In the case that this fails, it also lines the uterus, so implantation is less likely to occur. Implantation is the stage of pregnancy at which the embryo adheres to the wall of the uterus.
So how effective is the patch? Patch is 99% effective for preventing pregnancy, but keep in mind that it does not protect against HIV or any other STDs or STIs.
So how do you use it? So you apply the patch once a week on the same day of the week for 3 weeks in a row. And the patch can be applied to the abdomen, buttocks, upper torso, excluding the breasts, or on the outside of the upper arm. And the location must change every week. And so on the 4th week, the patch should not be worn. This is when menstruation will occur, and you are still protected from pregnancy during this time. So after week 4, you repeat the process.
So some pros of the patch is that it's very effective, 99%, as we said. It only has to be changed once a week, and the person using it can predict when their period will come. Some cons of the patch, the hormones of the patch will increase clotting factors in the blood, which can increase the risk of heart attack and stroke. Additionally, smoking while using the patch is not encouraged and will increase the risk of heart attack and stroke. Some other side effects may include breast tenderness, nausea, weight gain, and spotting, but many of these are not serious and are temporary.
Right, so where can you get it? You can get them at doctor's office or clinics, but you have to have a prescription by a clinician or really a doctor. So you have to go there first.
When should you use it? Once again, the patch must be applied every 3 out of 4 weeks. Ortho Evra does not protect against HIV or other STIs, so an additional method of protection like an internal or external condom must be used along with the patch every time you have sex. Condoms can prevent HIV and other STIs and demonstrates that you care about your own health and about your partner's health.
So what does it cost? So the patch could cost up to $150, but with most insurances, it's free. So it really depends on your insurance that you have, though. So.
Thank you for listening to our presentation. We hope you learned something.
Spermicide. Okay, so what is spermicide? Spermicide is a form of birth control that uses chemicals to block sperm from reaching an egg. It works by blocking the entrance to the cervix as well as stopping sperm from moving. Spermicide does not contain hormones, making it a barrier method. So the different types of spermicide. There's many different types of spermicide, some of them being spermicidal foam, which is inserted like a tampon 10 to 15 minutes before sex, contraceptive film, a thin sheet of film which gets folded and inserted into the vagina, which then melts to create a gel, used 10 to 15 minutes before sex. Spermicidal jelly, usually used with a diaphragm or a cervical cap, which gets squeezed onto its applicator and inserted into the vagina. Contraceptive inserts or tablets, solid forms of spermicide which get inserted into the vagina and melt into a foam, inserted 10 to 15 minutes before sex. And the contraceptive sponge, a soft round barrier that gets dipped into water and then inserted into the vagina and then releases spermicide.
How effective is spermicide? Spermicide used alone has a higher failure rate than most types. It is a 28% among typical users. And this means that in 1 year, 28 out of 100 women who use spermicide as their only method of birth control get pregnant. So the percent use is a failure rate. The pros, when combined with other barrier methods, condom, diaphragm, or cervical cap, the combined failure rate is between 3 and 10%. Doctor visits are not required to obtain spermicide, so they're easily attainable. It is usually accessible at grocery stores, drugstores, and supercenters like CVS and so forth. It is inexpensive and easy to carry. And then there are cons. Spermicide must be inserted less than 30 minutes prior to intercourse, and then and ideally less than 20 minutes. It must be inserted for each act of sexual intercourse, so it's a one-off. It requires another barrier method to avoid higher failure rates, which is kind of annoying, but if you double up, you should be okay. And spermicide does not protect against STDs or STIs. That's it.
We'll be talking about birth control implants. Birth control implants is a form of a contraceptive. It is a small rod that is inserted under the skin of a woman's upper arm, and it can prevent pregnancy for up to 4 years. How does it work? The implant releases a hormone called progestin. Progestin keeps ovaries from releasing eggs. It must be inserted by a healthcare professional. Prices. They can cost anywhere from $10 to $1,300 to put in, depending on your healthcare provider. However, the vast majority of healthcare providers cover the cost. They also need to be removed and can cost anywhere from $0 to $300 to remove, again depending on your healthcare provider.
The benefits are one of the highest levels of effectiveness for all contraceptives. Fertility returns as soon as the implant is removed. There's no need to worry about birth control for over 3 years. And it contains no estrogen, so if it's appropriate for women who can't use birth control that contains estrogen. Side effects include headache, breast pain, nausea, ovarian cysts, infection at the site of implant, acne, and changes in menstrual cycle may occur. The disadvantages include there's no protection against STIs, there's a high upfront cost if it's not covered by insurance, and the device must be removed after 4 years. And some general facts are it's over 99% effective, it lasts up to 4 years, but it can be removed. It's available at only some clinics, and it does not protect from STIs.
Hey Liv, what's up?
Not much. How about you?
Nothing much.
Wait, actually, I need to ask you about something.
Yeah, sure. What's going on?
Well, I had sex a couple of nights ago. It was so stupid, heat of the moment, and we didn't use protection. I'm really scared. What if I'm pregnant? I am not ready for a baby. Do you know how much work that is? I want to go to college, get a job, and then do the marriage thing and baby stuff. What should I do?
I hear you. And lucky for you, I know about something that can help. An emergency contraceptive pill. It comes in a lot of different brands, like Plan B or Ella. It comes in a little box with a couple pills.
And that will make sure I don't get pregnant?
It should. It contains progesterone, you know, the hormone. Anyway, it's meant to prevent the egg from being fertilized, therefore preventing pregnancy. But a con is it won't wash away any STIs you could have gotten, so you should get tested soon.
Right. I didn't even think of that. Okay, I'll make an appointment at the clinic. As far as pregnancy, will it definitely work?
Well, kinda. It only happened, 48 hours ago? It's 88% effective within 72 hours, so you should be fine, but there's a chance it won't work.
Okay, how do I take it? Is there anything fancy?
Nope, just take the pills as if they were Advil.
Oh, that's easy. But where would I get it?
They should be at most pharmacies, like the CVS on Nassau, or even at the Planned Parenthood clinic in Trenton. And the thing is, Plan B is over the counter most of the time, doctor visit free.
Will I even be able to afford it? How much is it?
Usually, Plan B costs about $40 to $50. Otherwise, it depends on insurance.
Okay, cool. Are there any weird side effects? I don't want to take any risks, bigger than the ones that I've already taken.
The side effects are minimal. You might get some nausea or headaches, and your period might be irregular for a little bit. On that note, you should know if it's worked if you get your period within a couple of weeks. If not, you should take a pregnancy test, just to be sure.
Right. Wait, is this like an abortion?
No, not at all. Emergency contraceptives prevent a pregnancy from occurring. They won't disrupt an already established pregnancy.
Okay, that's good. It'll be okay.
It will.
Hey, do you think you could come to the clinic with me? I'm kind of nervous.
Yeah, of course. I'm there.
Thanks so much, Frankie.